Hi everyone, another explainer video here, this one for the Satisfaction and Recovery Index, or the SRI. I won't spend too much time describing what the SRI is. I'll show you where you can find a paper here shortly to learn more about it. In a nutshell though, it's meant to measure importance-weighted, health-related satisfaction, and was developed over many years and many steps to be a region-independent measure of the good things about recovery, as opposed to region-specific measures about how disabled or impaired one feels, which you might find in the Neck Disability Index or Roland Morris questionnaire, those kinds of things. I've got here the Pain and Quality of Life Integrative Research Lab's website, the pearlresearch.com. And if you come to this website, you're going to be presented with the home page, and across the top you're going to see a series of links. One of those is Clinician Resources. By clicking on Clinician Resources, you'll be taken to a page that includes a growing list of free-for-use clinical tools that people can use. There's apps on here, there's different tools that we've created through the lab. What I'm going to do is I'm going to click on the very bottom one, which is Satisfaction and Recovery Index. By doing that, I will jump right down into the bottom of the page. And here what we can see is a real quick list of things about this tool. There's the tool itself, both in English and Canadian French. There's a user manual for those of you who want to access this in print form. And then there's a scoring spreadsheet, which I'll get to in just a moment. The tool itself, you'll also see that there's a link to a paper, and I'm also going to show you that in a moment. The tool itself can be accessed by clicking there. Again, this is all free for personal use in the clinic, so feel free to go ahead and use it. Here's the Satisfaction Recovery Index, and what I want to do here is just scroll down. You'll see that it's 10 items long. Now I say that it's 10, it's actually 9 items long. One of them, you'll look at item number 6, is a validation item, asking people to place a 4 in the first column and a 6 in the second. Pay attention to this. In our experience, about 5% or so of people actually fail the validation check. In other words, they're just not paying attention, and that should be enough to throw the scale out for that person, so do pay attention. The remaining items here are items that we generated over many years through conversations and focus groups with people who have pain in different regions, mostly neck pain for that matter, but it certainly will serve equally well in pain in other areas. Everything from meeting your most basic needs, eating, sleeping, personal hygiene, that sort of thing, all the way down to optimism for the future and everything sort of in between. The difference here with this scale, for one, as I've mentioned, it's region agnostic. In other words, it isn't specific to any one body region. But the other thing is that it asks people to give 2 ratings. One of them, the first one, is an importance rating. And the question here being, how important is this particular domain to your sense of health-related satisfaction? So for example, some people might find that meeting their most basic needs, not surprisingly, most people rate that quite high. But as we come through others, let's say, for example, intimate relationships, well, that may not be equally important to everybody. And this is what we think is an advantage over traditional scales, which assume equal importance of all items on the scale to all people. So if you were to take, for example, an item on driving, well, if a person doesn't drive, then whether or not they can drive is not really that important to their personal sense of health and satisfaction. The SRI allows people to actually make that call. Some who are familiar with the Canadian Occupational Performance Measure might identify a similar, or might recognize some familiarity there. After the patient first indicates how important each of those domains are to their personal sense of health, then they indicate how satisfied they are in each of those domains. And again, this was an important departure for us, away from asking people how disabled or impaired they feel, rather than asking them how satisfied they are, so something far more positive. Now, the scale itself, if you scroll right down to the bottom, on this PDF, you can print this off. It does have the scoring system on the bottom, and because this is importance weighted, the idea here is that you first create an individual item weighting for each item, which was just the importance score times the satisfaction score divided by 10. You then need a denominator here in order to create an overall scale score. What you're going to do here is you're going to find the sum of the weighted scores, which is what you just calculated, okay? And then you're going to add up just the importance scores in the left column. So the weighted scores divided by the importance scores, which this would actually be 100 if all of the weighted scores were 10, if everything was perfect. then you're going to get yourself a percentage. And you see, of course, this is going to range from 0%, completely unsatisfied with their health, to 100%, or completely satisfied. Now, of course, this takes a little extra burden, a little extra time than a simple scale of just summing up the numbers, but we also find that it is more responsive than some other region-specific or even generic scales. Fortunately, however, we've created a scoring tool for you to make this a little bit easier. So if we come back to the lab's website and we go right down to the very bottom here, we'll see a scoring spreadsheet. Now, if we click and open that, it'll bring us to a Google Sheets window. This is, again, free for personal use. And what you can see here is an example. I've already got some numbers filled in here. So I've imagined just a patient, and I've had them score, first of all, the importance of each of these different domains to their personal sense of health, and then I've asked them to indicate their level of satisfaction in each of those. You'll see here the validation item, which asks people to put a 4 here and a 6 here, and it is not weighted. In other words, it does not factor into the total score at the end. Here what we can see is the weighted scores. Now these scores are actually not editable, so you're unable to edit these. The only thing you can edit are the scores here. And then the total score is a calculation of all the weighted scores as a percentage. I just want to show you exactly how this works and what the value of weighting these things are. Let's imagine here we've got a person, and we'll use my intimate relations example here. So this person has rated intimate relations as not very important to them. For whatever reason, perhaps it's a person who is happily single or whatever the case may be, and so they've indicated that this is a 2 on their importance scale. Now they also, for whatever reason, happen to be unsatisfied at the time that this was started, but let's imagine that over time your treatment has been effective, and whatever treatment that may be has actually improved their satisfaction with intimate relationships. So let's imagine they've improved by 5 points, so we've gone from a 2 to a 7 here. Now watch the SRI score here at 58.08 as I change this. So I increase 5 points to a 7, and this has gone from 58.08 to 59.45. So about a 1.4% increase. Now what I'm going to do is I'm going to bring that back down to 2. Okay, 58.8, so our same starting point. Now let's imagine that we look at this one about being independent. Now here this is very important to the person, a sense of independence. They've indicated that as a 10. In terms of how important it is to their sense of health-related satisfaction. But again, they were not very satisfied when we started off. Once again, we'll say that we've treated them and they've improved 5 points, the same 5 points. So we've gone from a 2 again to a 7. Now watch that total score again. It's gone from 58.08 now up to 64.93, so an improvement of over 6, almost 7 points. So clearly, you can see the value of weighting these things by importance. What this means is that the same amount of change in an area that's very important to the person will lead to a greater overall scale score than will that same change in an area that's not important to the person. And again, we find this to be a more realistic, a more accurate portrayal of the person's sense of satisfaction. If you're interested at all and you go back to the website here, you'll also notice that there's a link here that you can click on to be taken to the paper in which we described this tool, the development of the tool, and I've actually got it open up here. So here we are. It was published in the Open Orthopedics Journal back in 2014. We've got myself and Dr. Joy McDermott and a number of students at the time that worked with me on this particular part of the tool. What I want to show you here is I'm just going to go right on down to the responsiveness estimates, which is right here, and that's table 4. What we did is we compared responsiveness, in this case looking at the area underneath the receiver operating characteristic curve, and basically this a higher number is better here, it's more responsive, so this would range from 0 to 1. The SRI was 0.82, and this was a sample of just about 30 people. Here's a region-specific disability scale, the NDI in this case, 0.79. And then the SF12 physical and mental component scores, you see, were not very responsive to change in this particular cohort. So in fact, of all of these, actually the SRI being importance weighted actually showed arguably the best responsiveness, not significantly better than the NDI, but at least as good, we'll say that much, which I think is nice for a generic scale. So that's the Satisfaction and Recovery Index. Again, if you want to read more about it, you can either read the paper or you can grab the user manual from here. I hope that's helpful, and if you have any questions, you're always free to connect with me. Thanks.